he could do whatever he did before the onset.
The deep brain stimulation that's given this child a chance at a normal life.
From a dermatologic perspective, these products really don't promote skin health.
Doctors warn that popular TikTok skincare regimens might do more harm than good, and how these teddy bears are making hospitals a little more comfortable for children. Welcome to Eye on Health, where we focus on stories that affect your physical and mental well-being. I'm Bradley Blackburn. We begin with a drastic shakeup at the CDC. Health Secretary Robert F. Kennedy Jr. dismissed a 17-member panel of experts that advises the agency on vaccine use, known as the Advisory Committee for Immunization Practices. The country became familiar with its work during the pandemic as part of the COVID vaccine approval process.
We have 11 yeses and 0 noes.
In an opinion piece published in the Wall Street Journal, Kennedy, a longtime vaccine skeptic, wrote that he wants to, quote, reestablish public confidence in vaccine science, and claimed the committee members had financial conflicts of interest. The move sparked protests outside CDC headquarters in Atlanta.
This is not a reorganization, this is destruction. And this means destruction for our agency, for the states and locals we support, and for the people in the communities that need our work.
CBS News chief medical correspondent Dr. John LaPook sat down with a former head of the CDC for his take on these major changes.
Vaccines are one of the greatest accomplishments of the past century, and now they are at risk.
When Dr. Tom Frieden was director of the Centers for Disease Control from 2009 to 2017, he received guidance from the Advisory Committee on Immunization Practices, or ACIP, a group of scientists who guide the CDC on vaccine policy.
It's one of the most respected institutions we've had.
The HHS secretary gave his vision for a new vaccine committee.
And we're going to bring people onto the ACIP panel, not anti-vaxxers. We're bringing people on who are credentialed scientists, who are highly credentialed physicians, who are going to do evidence-based medicine.
What's your best sense about what's behind this decision?
I don't think I can read Secretary Kennedy's mind, but I do know that his stated rationale of strengthening trust is not what he's achieving. What he's achieving is the exact opposite.
He has said that there are conflicts of interest that have not been addressed.
This is simply untrue. We strengthened the system 15 years ago.
How has it been strengthened?
If there's anyone who has a potential conflict of interest, they have to recuse themselves from all decisions and discussions about that topic.
Kennedy has long been a critic of vaccines. He testified in January that his recommendations would only be based on widely accepted science.
News reports have claimed that I'm anti-vaccine or anti-industry. I am neither. I am pro-safety.
Dr. John LaPook, CBS News, New York.
From the CDC to the NIH, dozens of employees at the National Institutes of Health are speaking out against the Trump administration. In a letter to Director Jay Bhattacharya, the group writes human safety is taking a back seat to politics and is urging officials to reverse major cuts to NIH research. Since the start of the second Trump term, more than 2,000 research grants have been canceled, ending some studies that were already 80% complete.
Because what is happening at NIH is so egregious.
Jenna Norton signed the letter. She oversees health disparity research at the agency's National Institute of Diabetes and Digestive and Kidney Diseases.
Every day I go into the office and I wonder what horrible thing I'm going to walk into, what ethical boundary I'm going to be asked to violate, what probably illegal action am I going to be asked to take. And it's just soul-crushing.
During a budget hearing, both Republican and Democratic senators questioned Bhattacharya about the fallout.
It is leading to scientists leaving the United States for opportunities in other countries. It's causing clinical trials to be halted and promising medical research to be abandoned.
The Trump administration's proposed budget for next year slashes NIH's funding by about 40%. A young Florida boy who once struggled to move or even hug his mother due to a debilitating neurological disorder is now swimming, biking, and running thanks to a treatment offered at just a few pediatric hospitals in the nation. Lauren Pastrana has his story.
Tamron Hendon's family goes to great lengths for his health. driving from Tallahassee to Miami for treatment.
You charge him once a week.
And putting a device in his chest to stimulate his brain.
So I'm only lowering the left side of your brain.
On a recent visit to Nicholas Children's Hospital, one of the few pediatric hospitals in the country performing deep brain stimulation, his doctor fine-tuned his settings.
It was miraculous. And now he swims, he rides his bike, he runs, he could do whatever he did before the onset.
But just over a year ago, Tamron's life looked very different.
I couldn't hug her. I tried.
In fact, he could barely move and was in a lot of pain due to severe dystonia, a movement disorder that causes muscles to contract.
He couldn't hold himself upright, and his back would bend and he would fall over. And it would be worse later in the day.
His parents sought help from doctors all over the state before meeting Dr. Migvis Mondui.
Even sitting in a wheelchair became very, very uncomfortable for him, so he was mostly bedridden at that point.
After running tests, Dr. Mondui found Tamron's dystonia was the result of a genetic mutation that responds well to deep brain stimulation.
This gets implanted typically under the skin in the chest area, and then there are cables that are going to be connected to this. Those are the leads, and those are going to be tunneled under the skin and then through the skull into the brain.
The device delivers electrical impulses that regulate abnormal brain signals like the ones that cause dystonia, Parkinson's disease, or epilepsy.
It was a really hard time, but now his cheerful self is back.
His parents say it feels like science fiction, but they're so grateful for this new reality. Lauren Pastrana, CBS News, Miami.
Skincare is a popular trend on social media for children, tweens, and adolescents. But a new study shows many of the products influencers are pushing contain potentially harmful ingredients. Dr. Malika Marshall has more.
Do my skincare with me.
More teens and tweens are showing off their skincare routines on social media. But a new study in pediatrics shows many of the products used in TikTok videos contain ingredients that could potentially be harmful to kids.
This girl, I think she's around 10 years old.
Researchers at Northwestern Medicine reviewed 100 videos from content creators ages 7 to 18 years old.
They had very few benefits in this pediatric population that they're targeting.
The products shown in the videos had an average of 11 potentially irritating active ingredients, including lactic acid, niacinamide, and vitamin E.
Girls were applying the same active ingredient over and over again unknowingly, which can increase the risk of skin irritation. Many of the inactive ingredients in the products carry a risk of allergy, which can be lifelong once developed. We also found that many of the most common active ingredients increase the risk of sun sensitivity, and yet only about a quarter of the videos showed the influencers applying sunscreen.
Study author Dr. Molly Hale says for tweens and adolescents without acne or eczema, sunscreen is the only product needed daily.
If there's some dryness, maybe a gentle fragrance-free moisturizer at night. A gentle soap-free, fragrance-free cleanser once or twice a day is more than sufficient.
Dr. Hale says the videos may also promote unrealistic standards of beauty.
Impossible beauty standard, because we know that from a dermatologic perspective, these products really don't promote skin health,
which could have negative consequences on mental health. Dr. Malika Marshall, CBS News.
Hospitals and visits to the doctor can be pretty scary for young kids, but a special visit for some elementary school students is helping medical care be more comfortable. Stephanie Stahl explains.
It's a different kind of field trip for these kindergarten students, seeing inside an ambulance and then inside a hospital.
Is she here for a checkup? Yeah, all right.
It's Cooper Hospital's annual Teddy Bears to the Rescue event.
Arm's broken? Oh, no. All right, well, we're going to take very good care of your teddy bear.
Here, teddy bears become patients, and the medical staff guide the students through diagnosing and treating them using real medical tools and equipment, showing things like x-rays and heart imaging.
He's got a good, strong heartbeat. Oh, he sounds much better. All right, I think the treatment worked.
This helps to increase their familiarity, get comfortable with who they might be seeing in the event they ever have to come back. We help to ease their anxiety around coming to the hospital.
6-year-old Messiah named his teddy Blueberry.
He went outside without a coat, and then he got sick.
This group imagined all kinds of situations.
She was climbing on a palm tree and she fell off. She was riding her scooter without a helmet, and then she fell off, and then she broke her leg.
Good job. You want to wheel them around? Go ahead.
A physical therapist explained why wheelchairs and crutches are sometimes necessary.
The coolest part is just getting to work with the kids, getting them comfortable being here, getting to teach them, what we do every day.
If you don't know how to swim, that you're wearing a life jacket, right?
Along with some prevention lessons like swimming safety, these students also learned about staying healthy and away from the hospital. Stephanie Stahl, CBS News, Philadelphia.
Coming up, the risks women are taking in Afghanistan to treat other women, and why it's never too late to dive into a healthy lifestyle. Welcome back. The World Health Organization says about 300,000 people drown each year worldwide. With summer fast approaching, Americans of all ages are picking up a life skill that boosts fitness and, for some, happiness. Stephanie Stahl reports on how it's never too late to learn to swim.
Amelia Maya is learning to swim one lap at a time.
I always wanted to swim, of course, as a child.
She says growing up in Portugal, her parents kept her away from the water. They didn't swim, so neither did she. But now, at 58 years old, she's diving right in.
I feel that I'm getting there.
There it is.
The fear factor is hard to shake off, especially with older swim students. That's where Drexel University instructor Rob Heller comes in.
I think what we're looking to do is get rid of fear. At any age, what is it to make someone comfortable where they are? Short of water up their nose, it's going to be okay.
CDC data shows 55% of U.S. adults have never taken a swimming lesson.
We need to understand the first rule of swimming, which is to float first and swim second. If you can relax, you can float. And if you float, then we can work on the mechanics of swimming.
Health experts say swimming is a low-impact workout that benefits both the mind and body.
The breathing and getting the heart rate up, there's no impact typically in the water. And it just feels good.
And those positive effects are flowing like water into Maya's everyday life.
It just makes me happy. It makes me smile. It makes me feel good about me.
As she improves her swim game,
I always say give it a try. And don't give up.
Maya hopes to one day scuba dive with her adult son.
It's a dream.
Stephanie Stahl, CBS News, Philadelphia.
Half the population goes through it at some point, but the transition into menopause is often treated as a big secret. That's changing with a push to educate women on what to expect. Danya Backus has the story.
Perimenopause hit Alice Henry like a tidal wave. After a hysterectomy, symptoms began almost immediately.
No one can really prepare you for how severe they really are, and every woman, I think, experiences them differently.
For Henry, they included night sweats, weight gain, and hair loss. After 6 unhappy weeks, she started hormone replacement therapy.
After I started the estrogen patch, the symptoms cleared up almost immediately. Within a week, I was back to feeling myself.
Perimenopause is the period before menopause and can last several years, in some cases as long as a decade. But a new study finds many women go through it in the dark.
They're feeling really lost and confused, and they don't really understand what's happening.
Their survey found 61% of women believe they will reach menopause in their 40s. In fact, it hits most women in their 50s, though some may experience symptoms as early as their 30s. Whenever it happens, it's a cue. It's time to prioritize a healthy lifestyle.
Getting adequate exercise, strength training, making sure we're getting lots of fiber in our diet, getting plenty of protein.
And not being afraid to ask for medical solutions, which can include non-hormonal options.
Sometimes we'll use antidepressants for hot flashes and night sweats. You don't have to suffer. This isn't a time of life that's miserable and you're going to feel awful forever.
Henry asked the right questions and had a doctor who knew how to help. And she shared her struggles with her daughter. So when her time comes, she'll have the information she needs. Danya Backus, CBS News, Los Angeles.
Afghanistan is one of the most dangerous places in the world to give birth, and the Taliban's takeover a few years ago has made women's health care even harder to come by. Imtiaz Tayyab has been following the plight of women there and how a loophole is being used to get around a ban on female education.
Dr. Najma Sama Shafajo is Afghanistan's best known and most experienced OBGYNs. She became a household name from her regular appearances on Afghan TV channels, where she talked openly about women's reproductive health, a subject still considered taboo. Over the past decade, we have made several visits to her private clinic in central Kabul and have never seen it this busy. Her clinic was flooded with new patients after the Taliban banned women from nursing and midwife training courses back in December, and it started to take its toll.
You have been suffering from migraines for quite some time. Why do you think that is?
Because of tension. I see my patients very poor, they cannot pay. I cannot help them, and all the pressure comes on me and I get headache.
Dr. Shafajo has also remained a committed teacher and has found a way to get around the Taliban's education ban for her student nurses and midwives. She gave them all jobs at the clinic, which means they're technically no longer students, but employees, even as she continues to train them.
The previous doctors, midwife, nurses are getting older and they will die. Who will provide services?
So you're expecting a catastrophe?
For sure, the number of deaths will be increasing. And one day, there will not be female in Afghanistan.
An Afghanistan without women. The Taliban insists that's not what its policies are aimed at. In the courtyard outside the clinic, we tried to ask some of the husbands, fathers, and guardians what they thought about the Taliban's ban on maternal health education for women.
Obviously, it's difficult to talk about these things.
Yes.
But no one wanted to talk.
What is your message to the Taliban?
As a doctor, as a mother, as a woman, as a Muslim, I request them to give chance for the female to help you to build the country.
Imtiaz Tayyab, CBS News.
After the break, why some people can operate on just a few hours of shut-eye and the importance of HIV testing. Welcome back. This June 26th is the 30th annual National HIV Testing Day. It began in 1995 as a way to encourage people to get tested for the virus, know their status, and get linked to care and treatment. While there have been great strides in treating HIV, testing remains critical and there are gaps in access across the country. For more on these issues, we spoke with Dr. Antonio Crespo, an infectious disease expert at Orlando Health Medical Group.
Dr. Crespo, what is the status of HIV testing right now? Are people still getting tested in the way they need to?
Yeah, I think that we have come a long way in terms of HIV testing, but there is still work to do. I think that there is definitely available in many communities, particularly here in the United States. There are some groups still that we need to do a better job. Some of the minorities, the younger population also seem to be a little bit less concerned, I would say. And sometimes testing could be better. Women is also another group that sometimes is under tested, but test is available, is very good, is very effective. We need to continue to promote testing.
You mentioned younger generations. Does the wider availability and adoption of PrEP medications change the way some people think about HIV testing? And is it still important to test even if you're on one of those medications?
Absolutely. Actually, I think it's true. I think PrEP sometimes give people a false sense of security about acquiring HIV. It is important that if somebody is taking PrEP, we actually do routine testing, depending on the type of medication. At least every 3 months, we do test, because if you acquire HIV while taking PrEP, there is a big risk of developing resistance right away since the beginning of the infection, and that is a bigger problem.
Why is free testing an important public health tool?
It increases access. Sometimes one of the reasons to not being tested is a lack of health insurance, for example. So people may not want to go and seek healthcare, and that may delay testing. So having these programs definitely increases the outreach to especially to many communities in need, that sometimes, as I mentioned initially, some of them are the ones that still we're lagging in terms of testing.
We know that the U.S. government's efforts to fight the HIV/AIDS crisis globally had been one of the big success stories in public health in recent decades. But with the cuts in Washington to USAID, some doctors are sounding the alarm that a lot of the progress that was seen could be reversed. What are you seeing? What are your concerns?
I think that definitely could happen. I think that's a concern. I think we'll have to see. I think for years these communities have been relying on these funds, and they now will have to adjust, and we'll see what changes happen. But it is a concern that many on the infectious diseases community share.
Dr. Antonio Crespo with Orlando Health Medical Group, thank you.
Thank you.
It's one of life's mysteries why some people can seem totally refreshed on just a few hours of sleep. A new study suggests that a gene mutation may be the explanation why for some 3 to 6 hours of shut-eye is enough. Dominic Garcia has details.
Imagine getting only a few hours of sleep and being raring to go the next day.
Truly find themselves going to bed, say at 10 p.m., waking up at, say, 3 in the morning, and they are wide awake and refreshed and ready for the day.
We spoke to Dr. Temitayo Oibile-Chidi, Associate Professor in the Department of Neurology at UC Davis Health. She says they've known about genes associated with short sleep for some time. This is just the latest one. And while it sounds great, you probably don't have it.
What's quite special about these is that they're very unique and very uncommon. So what I find is that whenever a new mutation comes out, a lot of my patients will come in and say, maybe I have that mutation or that gene mutation. Let me get checked for that or get tested for that. And that's where I often say it's very, very rare.
So how do you know if you're a short sleeper? Well, you can get tested, or just ask yourself, are you tired?
If you find yourself, managing during the week on 2 to 3 hours or 2 to 4 hours of sleep, but then you end up on weekends sleeping in for 10 hours, you probably are not a short sleeper.
So make sleep a priority. Get a routine bedtime, no screens, and sleep in a cool room.
Sure that you are actually getting a good amount of sleep and giving yourself enough time to get that 7 to 9 hours.
Dominic Garcia, CBS News, Sacramento.
I'm tired just thinking about it. That's Eye on Health for this week. I'm Bradley Blackburn. Thanks for joining us. Be well.